Hello, healthy mommies. Breastfeeding may be natural, but it isn't always easy. The truth is, it might be challenging sometimes, and you should be ready for these challenges. The good news is, with time, as you and your baby learn this new skill, it might get easy, which is the reason why today, to improve your breastfeeding journey and make it more enjoyable and longer, we are addressing 12 issues which might be causing a painful breastfeeding and giving you remedies for them. As mothers, we all hope to have a blissful breastfeeding from the first feed, but there are some discomforts that might appear. According to a study conducted by the FDA and CDC, over 75% of women experience breastfeeding pain within the first 2 weeks postpartum, yet only 54% of them actually ask for help. It is time for us to open up and share our problems so we can get help and breastfeed our children for as long as we are supposed to because they need it. Let's go right into the problems and let me give you solutions so you can enjoy breastfeeding and your baby too. The first problem which most mothers experience is a poor latch. It's normal for you to feel some pain or discomfort when you start breastfeeding, especially if it's your first time. But if it lasts for more than a few seconds, then you need to make sure that you're latching your baby well. A poor latch can lead to several other breastfeeding problems, which is the reason why we have to try to put our babies on our breast the right way to prevent many other problems which might occur. But it is okay. Being a first-time mom, we are learning and the baby is learning too. So with time, it's going to be okay. Some few tips I can give you to get a perfect latch is try to rub your nipple on the top part of your baby's mouth so that they can open their mouth well enough before you put your breast into their mouth, and make sure your baby is sucking around your areola, the dark part of your breast, and not just on your nipple, because that is one other thing which can cause a sore nipple and many other problems. Since a poor or shallow latch is a problem which causes a lot of breastfeeding problems, we are going to create another post to explain how to get a perfect latch. So stay with us till the end of the breastfeeding week. Now, on to problem number 2. The second problem is cracked nipple. This is one of those problems which can result from many different things. A shallow latch, pumping improperly, thrush, which we are going to talk about later, and sometimes even dry skin. During the first week of breastfeeding, when your baby is learning to latch, you might experience cracked nipple, which might be very frightening, but with the following remedies which we are going to give, it's going to be fine in less than no time. The first thing you have to do is to try to identify why you're having a cracked nipple. So when you're putting your baby to latch, make sure your nipple is actually far inside the baby's mouth, such that your nipple is not touching the hard palate which is above the baby's mouth, because that is what can cause a cracked nipple. And something you can do if you already have a cracked nipple is use a cold compress, maybe a towel, something cold, and put on the breast, and make sure to clean your nipples at least twice in a day, because when you already have cracked nipples, it can lead to bacteria living there and causing more problems. So we do use a nipple cream and a soothing pad or a towel which is cold and put on the breast. You can also use some mild painkillers which will help with the pain. But with time, as you learn how to breastfeed better and your baby learns how to latch better, it's going to be easier for you to deal with this or not have a sore nipple again. The third problem we would like to address is breast engorgement. Engorgement can be so uncomfortable for the mother and make it difficult for the baby to latch. It is a condition whereby your breast gets so full with milk and become firm and taut, making it hard for the baby to latch. Now, breast milk comes in between 2 to 5 days after delivery, and if you gave birth via a CS, it could take longer. But there are simple things which you can do to help yourself solve the problem of engorgement. One thing you can do is to try to feed more often. Do not stay a lot longer before breastfeeding your baby. Another thing you can do is to pump the breast milk out. You can also use a warm towel and put on top of your breast, or take a mild painkiller to help you with the pain. Breast engorgement is really severe and sometimes can give women temperature, but it's going to be okay. As you keep breastfeeding, it's going to normally free your breast and reduce the amount of breast milk in there, though your breasts are going to be making more breast milk. But as you keep breastfeeding, you're going to feel better. So try to continue breastfeeding despite the pain. For problem number 4, we address clogged ducts. This is a problem which might arise because of breast engorgement. When your breasts are overly full or you've gone longer than usual between feedings, milk can back up into your ducts and clog them up. You'll know you've got a clogged duct if there are hard lumps on your breast, if your breast is sore to the touch, and if there is some redness. But in other case, if you've got a fever too, that's a sign of mastitis, which is a condition which we'll talk about next. Other causes of clogged duct might include compressing your breast while sleeping, using wrong size breast pump to pump your breast milk, something touching you on a particular spot of your breast continuously, which might usually be the underwire of a bra, but sometimes some women are just prone to have clogged duct without any underlying causes. To remedy this condition, all the solutions for breast engorgement can work, but also you will need to take some rest, and a massage can really help you unclog your ducts. Also, vibration can work, but do make sure to take a lot of rest if you're having clogged ducts. Now we move on to the 5th reason why you might be having painful breastfeeding, which is mastitis. Mastitis is a bacterial infection in your breast marked by flu-like symptoms such as fever and pain in your breast. It is common within the first few weeks after birth, though it can happen at any time during breastfeeding and may be caused by other breastfeeding problems such as clogged milk ducts, engorgement, and even cracked nipple, which allows bacteria to enter your breast, causing an infection. Now, to treat this condition, your doctor will have to give you antibiotics and other things to help you prevent the bacteria from growing into something too serious. But then you will also have to try to always empty your breast, or if it is too painful, I would advise that you pump the breast milk out so that you don't encourage clogged duct, which might even make mastitis more painful. Also, you can use a warm compress, that is like a warm towel, and put on the breast as it's going to soothe the discomfort. We move on to problem number 6, which is white spot. This usually shows itself as a small sized spot on the tip of your nipple, which looks like a milk-filled blister. Most times, if it is not painful, it can resolve itself on its own without you needing to do anything. But if it is painful, then you need treatment, which might be soaking your nipple into warm water for about 5 minutes from time to time to help dissolve that particular blister. Now let's move on to problem number 7 with the big names. Problem number 7 is called vasospasm. It is a condition whereby if your baby takes off the mould from your breast, your nipple look kind of white and you feel a burning pain. If also your nipple goes white when exposed to cold and cause a burning pain, then you might be suffering from nipple vasospasm. So you might need to consult your doctor to help you with this condition, because they are the ones who can prescribe the drugs you need to solve it. Problem number 8, it is called thrush. So this particular condition is very similar to nipple damage or cracked nipple or bacterial infection. So it is very important that if you're feeling a very stabbing pain after feeding and a kind of pain that kind of goes into your breast, then you might be having a thrush. So you should consult with your doctor, because a thrush is a yeast infection which is caused by a certain bacteria which can also transfer to your child. When it transfers to your child, it will make their tongue to be very white in such a way that when you clean it, it doesn't get clean. So if you have a thrush, it's very, very important for you to see your doctor for it to get remedied so that it doesn't transfer to your baby and cause worse condition. So let's move on to problem number 9. The next thing which can cause pain during breastfeeding is if you are using your breast pump the wrong way. Now, breast pumps usually comes with different types of heads, and you have to buy the one which suits your nipple or the front of your breast. There are some which are smaller and there are some which are bigger. If your breast is too far inside the breast pump, then it means it is big for you. And if your breast is touching the corners of the breast pump shield, then it means it is small for you. So you have to position it well and also use the breast pump which is the right size for you, so that you don't cause issues on your breast and then when you're breastfeeding you have pain. So the solution that you have to do here is maybe get to a lactation consultant to choose the right size of breast pump for you and show you how to use your breast pump perfectly. Now on to problem number 10. Problem number 10 might seem funny, but yes, it is true. Another reason why you might be having a painful breastfeeding is because your baby is biting on your breast. And most times when babies start eating around 3 months, which you should still be breastfeeding them, they start biting on your breast. A remedy for this is for you to buy them teething toys so that they can bite on those things, and when they get on the breast, they know it's time for feeding and do not stress you by biting your breast. Please do not hit your baby. You can instead caution them quietly and tell them, no baby, you don't do that, you're hurting mommy, instead of hitting them so hard when they do it. We know it's painful, we've all experienced it at some point, but please try to take control of yourself before you hurt your baby. For problem number 11 and 12, they are not very severe reasons why you should be having pain during breastfeeding, but there are things which you should know that can affect your breastfeeding. The first one is tongue tie. This is a situation whereby your baby has a ligament under his or her tongue which attaches the tongue to the lower part of the mouth, which makes it difficult for the baby to latch, and that can cause problems because if the baby is not latching properly, then you might have issues of sore nipple and the many other problems which might come up. So if your baby has a tight tongue, it can actually be rectified. You can take the baby to the hospital and it can be adjusted. For problem number 12, which can also affect the latch, it is a lip tie. So instead of this attachment being at the bottom of the mouth, you would see it at the top of the mouth like in the picture illustrated above. So those are things that can cause a painful breastfeeding, and we hope that the remedies that we've gotten today can help you to have a more blissful breastfeeding, because if breastfeeding is not made easy and pain-free, then mothers cannot breastfeed for as long as 2 years as the World Health Organization requires of us. So thank you so much for joining me today. Did you learn something? If you learned something, do not forget to share this video with someone. And please, if you're new here, do not forget to subscribe and like the video and leave a comment of one thing which you learned and one other thing which maybe helped you with your breastfeeding pain. Thank you so much for joining us today, and do have a beautiful day. Stick with us till day number 7, which we are talking just about breastfeeding, and you're going to learn a lot. Thank you so much. Do have a blissful day and a beautiful breastfeeding.